If you're taking propranolol for anxiety, tremors, or heart issues, you need to know about its side effects. Many people suffer from fatigue, dizziness, or even depression on this medication, but doctors rarely warn them. Today we're revealing all propranolol side effects, plus proven ways to reduce them so you can stay safe and feel better. Stick around, this could change everything. What is propranolol and how does it work? Propranolol is a type of medicine called a beta blocker, and more specifically, a non-selective one. That just means it blocks certain stress-related signals in your body, helping to slow down your heart rate and reduce blood pressure. What is it used for? Doctors use propranolol to treat a variety of health problems including high blood pressure, to help prevent heart problems, tremors, shaky hands or body, migraines, to stop them before they start. Interestingly, some doctors also use it off-label to help with performance anxiety, like stage fright. It doesn't change how you feel emotionally, but it can calm down the physical symptoms, like a racing heart or sweaty palms. How do you take it? Propranolol comes in two main forms. Immediate release, IR works fast, wears off quickly, usually taken several times a day. Extended release, ER works slowly, lasts longer, often taken just once a day. Important, the IR and ER versions aren't interchangeable, they're sometimes used for different conditions. So, always follow your doctor's instructions carefully. What are the side effects of propranolol? Like all medications, propranolol can cause side effects, though not everyone gets them. Some are mild and manageable, while others are rare but more serious. Let's go through them in a way that makes sense. Common side effects, the ones we see more often. These are things you might notice, especially when starting the medication or adjusting the dose. Tiredness or fatigue, you might feel more drained than usual. Slow heartbeat, propranolol calms your heart down, sometimes a little too much. Low blood pressure, you could feel dizzy or lightheaded when standing up. Sleep issues, insomnia, some people find it harder to fall or stay asleep. Cold hands and feet, due to reduced blood flow, a bit like in Raynaud's phenomenon. Numbness or tingling, usually in the hands or feet. Nausea or vomiting, your stomach might not love the adjustment. Cramping or muscle weakness, occasionally happens as your body gets used to it. Mood changes, feeling down or depressed isn't common but it can happen. Blood sugar effects, it may raise or lower blood sugar, especially in people with diabetes. Breathing-related side effects, because propranolol affects the whole body including the lungs, it can cause shortness of breath, wheezing, bronchospasm, a tightening of the airways, more common in people with asthma or lung issues. Pulmonary edema, fluid in the lungs, rare but serious. Respiratory distress, trouble breathing especially if you already have lung problems. Rare but serious side effects, seen less often. These are uncommon but require medical attention if they occur. Heart failure getting worse. Severe allergic reactions, like swelling, rash, or trouble breathing, including anaphylaxis. Rashes and skin reactions. Some rare, serious types include Stevens-Johnson syndrome, toxic epidermal necrolysis, hives and exfoliative dermatitis. Muscle problems, such as myopathy, muscle pain or weakness, or myotonia, difficulty relaxing muscles. Mental health symptoms, like confusion, hallucinations, or psychosis, very rare. Pharmacist tips for taking propranolol. If you're starting propranolol or have been on it for a while, here are some practical tips to help you get the best results and stay safe. 1. Take it at the same time every day. You can take propranolol with or without food, whichever is easier for you. But consistency is key. Try to take it at the same time each day so it works steadily in your system. 2. Taking the long-acting version? Bedtime might be best. If you're using the extended release, long-acting capsules, you might feel a bit dizzy in the first few hours after taking it. To avoid feeling woozy during the day, some people find it helpful to take their dose at bedtime so they sleep through the worst of it. 3. Be cautious with activities at first. Until you know how propranolol affects you, avoid driving or operating heavy machinery. Some people feel dizzy or faint when they start it or when the dose changes. The good news? These side effects usually go away within 1 to 2 weeks. 4. Watch out for dizziness when standing up. Propranolol can sometimes cause a sudden drop in blood pressure when you go from sitting or lying down to standing. This can lead to dizziness, lightheadedness, or even fainting. Tip: try standing up slowly, especially in the morning or after resting. If it keeps happening, talk to your healthcare provider. There may be other options. 5. If you have diabetes, be extra careful. Propranolol can mask some symptoms of low blood sugar like a fast heartbeat. If you're diabetic, you may not feel the usual warning signs of low blood sugar. Sweating is one symptom propranolol doesn't hide, so pay attention to that. Always check your blood sugar regularly, and let your doctor know if you've had any episodes of low sugar. 6. Don't stop suddenly. It's important not to stop taking propranolol abruptly. Doing so can cause your blood pressure to spike and increase the risk of a heart attack or stroke. Always check with your doctor first if you're thinking about stopping or changing your dose. How to cope with side effects of propranolol. If you're dealing with some of the common side effects of propranolol, don't worry, there are simple ways to ease the discomfort. Here's how you can manage the most frequent ones. Headaches. Headaches can happen especially when you're new to the medication. What helps? Rest in a quiet, dark room if you can. Drink plenty of water throughout the day. Avoid too much alcohol, it can make headaches worse. Ask your pharmacist for a gentle pain reliever that's safe to take with propranolol. Talk to your doctor if the headaches last more than a week or become severe. Feeling tired, dizzy, or weak. These symptoms are common early on but usually fade as your body adjusts. What helps? Take it easy. Give your body time to get used to the medication. If you feel dizzy, sit or lie down until it passes. Skip the alcohol, it can make dizziness and tiredness worse. Don't drive or ride a bike until you feel back to normal. Cold fingers or toes. Propranolol can reduce blood flow to your hands and feet, making them feel chilly. What helps? Warm them up with gentle massage or run them under warm water. Wiggle your fingers and toes regularly to get blood flowing. Avoid caffeine and smoking, they tighten blood vessels and make things worse. Wear mittens instead of gloves, they're warmer. And thick socks. Avoid tight jewelry or watches that might restrict circulation. Feeling sick, vomiting, or diarrhea. Some people get an upset stomach when starting propranolol. What helps? Eat simple, bland meals. Nothing spicy or greasy. Try taking your pill after a snack or meal to reduce nausea. Sip fluids often to stay hydrated. Water or diluted juice is best. Look out for signs of dehydration, dark pee or peeing less than usual. Don't take anti-diarrhea or anti-nausea meds without checking with a pharmacist or doctor first. If you're on the pill and have vomiting or severe diarrhea for more than 24 hours, your birth control may not work properly. Check your pill pack for instructions or talk to your doctor. Stomach pain. Mild stomach pain can happen, especially when your body's adjusting to propranolol. What helps? Eat slowly and go for smaller, more frequent meals. Relax and rest, stress can make it worse. A warm compress, like a heating pad or hot water bottle, on your belly can soothe cramps. If the pain is intense or doesn't go away, talk to your doctor or pharmacist. Now you know, propranolol side effects can range from mild, like tiredness, to severe, like low heart rate. If our tips help you reduce propranolol side effects, let us know in the comments. Hit like if this video helped you, subscribe to HeInfo for more life-saving health advice, and turn on notifications so you don't miss our next video. Your health matters, take care of it.